So today we'll be discussing indication for IVF, which means who and who needs to undergo IVF. However, IVF is an in vitro fertilization where the egg and the semen is fertilized outside the body and returned back into the body. So who and who needs this IVF? If you have that tuber factor, where the fallopian tubes are damaged or are bad, where the sperm cannot swim to where the eggs are, and the egg cannot reach the uterus, there's a need for IVF. If you have those male factors like low sperm count, poor sperm quality in terms of motility and shapes, there's a need for IVF. If you have endometriosis, unresolved polycystic ovary disease, there's a need for IVF. If you have unexplained infertility, where all the investigations have been done and nothing was found in both the male and the female counterparts, there's a need to try IVF. If you have those ovarian results that are very low and the egg quality of those results are also low, there's a need for IVF using what we call donor backup, which can also help you to be successful. If you have a genetic risk factor, for instance, a male or female being AS and AS, and you don't want to pass the sickle cell gene to your offerings, there's a need for a special kind of IVF, which we call pre-implantation genetic screening, to help screen out those sickle cell diseases and help you to have a healthy baby. There's a need for IVF in that. If you want to preserve your fertility, in that you're not ready to get pregnant yet as a young lady, or you're undergoing some treatment like chemotherapy and others, there's a need for IVF to preserve those ovaries or those embryo for further use. If you have failed treatments for fertility, meaning if you have tried some fertility treatment and it's still not working, there's a need for IVF. Join me in my next video when we're visiting some of this IVF clinic. I mean you sincerely. Thank you.